So, to be honest with you, and I've said this in the office to my patients before, I actually believe that everyone should have the opportunity to go to therapy at some point or the other. And likewise, I also feel that everyone at some point in their life likely needs to go to therapy. Therapy I think of really as an opportunity. And I know there's a lot of stigma and there's a lot of shame sometimes associated with therapy and mental health. But guys, we are going to break this down because honestly, going to therapy can literally be one of the most important things you ever do. It can be a complete game changer for your life. And once again, when I say that, I literally say to my patients that I believe that everyone should have the opportunity to go to therapy. I really mean that. I'm going to tell you when you should consider seeing a therapist, okay? But I'm also going to be very frank with you. You guys know that I'm honest with you. You know that I'm pretty transparent. I say more things to you guys than I do to my own patients, although I know many of my patients watch me on here, so there you go. But I believe in transparency because I believe with transparency, honesty, and vulnerability, I really believe it's our superpower. I believe that's how we can affect change and make change. And I want to start by telling you, I wasn't sure if I was going to start by saying this, but I think it's important. I have learned so much from being in therapy at different times in my life, but I put it off for a long time. I put it off for a long time because I was afraid of what it would mean if I went to therapy. I was afraid of what people might think. I was afraid and had issues with what I thought about myself. All of that, by the way, completely, entirely ridiculous. I thought it was, I felt some kind of way about being a healthcare provider that was here to help others, but yet I needed help. And by the way, which human on this planet does not need help? Yeah, that's everybody. Doctors too. And by the way, I especially think doctors need to be in therapy at some point. Guys, therapy is an opportunity. And so I speak to you and I'm telling you some of the times that should let you know, hey, maybe I should talk to somebody, not only from experience as a person and as a patient, but also as a doctor myself. I also want us to remember that, in this world that we live in, where mental health is so stigmatized, and it's got such, unfortunately, a ridiculously, horribly bad rap, which, by the way, makes no sense. Think about it this way, and I often think about this. Life is tough for everyone at different points in time. Life is never easygoing, smooth sailing for anyone. One of the definitions of life and being alive is that we go through ups and downs. That is part of the journey. So this idea that somehow we're flawed because there are times when things are less than ideal, well, that in and of itself is a flawed theory or a flawed concept or flawed ideal. That makes no sense because what life is this. We have ups and downs. We have ebbs and flows. We learn, we grow. We take 2 steps forward. We take 3 steps back. We take 5 steps forward. We take 3 back. So I'm going to give you a number of reasons that should maybe signal to yourself that, maybe I should consider talking to someone. This is just food for thought. And it's not to say that you need to see a therapist because there are many people who may not need to, may not necessarily benefit from it. But I've always felt that it is an opportunity, really, honestly, for us all. So let me say the first thing is, by the way, okay? The first thing is, gosh, okay, how do I say this? Because I have a whole list of things. Okay, first thing I want to do is say that sometimes we're afraid. Therapy, I think, gets a bad rap for a number of reasons. And I'll just mention a few of those off really quickly. Number one, I think sometimes people are afraid to talk to someone else that they don't know about their business. I think sometimes people may say, well, I don't even know how to go about this. Okay, I'll give you some suggestions at the end about how to go about finding a therapist or what you need to do. I think some people worry about the stigma and what people may think of them if they knew they were in therapy. I think sometimes it's scary for people when they realize they need help outside of themselves. And this is the other thing I would say too. Okay, this is what I was going to say that kind of slipped my mind. A lot of my patients, and I see this day in, day out, if they're resistant to therapy or medications or both or what have you, one of the reasons that I hear people say as a reason why is they say, well, I've always been able to manage this myself. I've always been able to get through things. I've always been able to handle things, and I don't know why I can't. Oftentimes, I've had patients who indicate to me that they see it as a sign of failure that they need a therapist, that they see it as a sign of defeat or something lacking in themselves, that they need someone else. And the truth of the matter is that's not what therapy is about, and it's also not what that means. So, a few things, okay? And I say this with love and kindness and every ounce of goodness in my heart because I know how helpful therapy has been for me over the years. to the point where I believe, I've said this, I think everybody should have the opportunity to go to therapy, but also how it's helped my patients and what it can do for people in general. So the first thing is, when should you go to therapy? When should you consider therapy? Well, number one, when you feel like you need help. Okay? And I know it sounds very vague, but when you feel like you need help or when you're struggling and things are not getting better, you feel overwhelmed, you're maybe repeating patterns, you feel stuck in a rut, you can't seem to pull yourself out of something. And that something can be a lot of different things. Number two can be just by, and I know many of us throughout our lives have probably said things like, oh gosh, I really wish I could talk to somebody about this. Now, does that phrase mean that you need to see a therapist? I don't know, maybe, maybe not. But the idea is sometimes just the thought of it may be enough of a signal for us to pay attention to, okay? If you've had the thought, gosh, I really wish I could talk to somebody about this. Maybe you've talked to your family and friends, you've exhausted those resources, or maybe it's not wise for you to talk to family and friends. Maybe you need to talk to someone else. By the way, that is a reason to talk to a therapist, is because it's someone outside of you. You know, that should sort of pique your interest and say, let me give this some real thought. Another time to sort of consider seeing a therapist is when you need to better understand yourself. This is one of the best things about therapy that I love. Is I think a lot of times we think about therapy as, I don't know what people think about it. I think a lot of people think about it as like the person on the couch, the therapist or the psychiatrist on the couch. And by the way, a lot of therapy today is not done by psychiatrists, but is done by licensed clinical social workers, psychologists, and other mental health care professionals, by the way. But I think people think about them like laying on a couch and someone saying, let me tell you, But this is the thing. Therapy does a lot of things. It not only maybe helps you with whatever you're struggling with, but it helps you understand yourself. It helps you understand, well, oh, that's why I respond every time this happens. Or that's why I feel like this every time I encounter that. Or every time I'm going through this. And having that level of understanding about your triggers, your coping skills, why you do what you do, guys, that's golden. I mean, honestly, it's one of the keys, I think, to life is to understand how and why you respond the way you do. Another reason to consider, or time to consider going to therapy, is if you've had a significant life event. It can be a traumatic life event. It can be that you lost your job, that you lost a partner, a spouse, a family member, that something terrible has happened in your life, something amazing has happened in your life, some life event that is significant that you need to have some guidance, some guidance through, okay? Whatever that might be. You have an ill family member, you're now a caregiver when you weren't before, whatever that might be. Another reason is that, maybe you find that your actions, how you're behaving, is not congruent with how you feel, or you feel out of control, or your actions are affecting other people. Maybe you have a short fuse at home. Maybe your temper goes off. Maybe you just don't quite feel like yourself and you're not able to get a handle on it. Right? Because when we talk about seeing a therapist, there's many, many different reasons why you can go. But generally, when people get to the point where they want to talk to somebody, it's because they've exhausted their own resources. They've gotten to a point where whatever they've done in the past has not worked. It doesn't work anymore. What they've tried in the past is not working anymore, or what have you. And that's very fair, and that's okay. It's not always that case with people, but in many cases, that's the case. You've done everything you can think of, and you're still struggling, and things are still not right, okay? Another reason to talk to somebody is you just need somebody impartial. Like I said before, you've already talked to the family, you've already talked to the friends, you've already talked to different people, but you know what? You need someone who's impartial. And the other thing is maybe you've been diagnosed with a condition, a medical condition. That can be either a medical condition that's psychiatric or psychological, or a medical condition that is not psychiatric, okay? Maybe you've been diagnosed with cancer or some other long-term condition and that you need to sort of get help as you sort of go through this. Maybe you've been diagnosed with anxiety or depression or bipolar disorder or something else, and you can use assistance as well. There's many different reasons, but having an underlying medical condition, whatever it might be, can be a big reason, okay? The other thing, too, is that sometimes people go to therapy because they need a tweak, okay? And that's very real and okay, too. This idea that you might be doing okay, but you feel like you could do better. And sometimes therapists can be great for helping you figure out how that can be done. Another phrase that I want to mention to you that I actually heard from a therapist is, I will never forget this. He's a therapist and he had said, invest in yourself. If you think about your role at home with your family, in life, you're probably caretakers, aren't you? Caregivers. You take care of maybe children, take care of family members, you may take care of elders, you may take care of spouses, you may take care of the household, you may work a job, you may take care of people at work. I mean, the point is, I know many of you who visit me and follow me on this channel, we were in this together, I know many of you look after a lot of other people. Your heart's in the right place. You care for others. But the question comes, are you caring for yourself as well? Are you investing in yourself the same energy that you invest in other people? And sometimes for some people, therapy can be a way to invest in themselves, to go through and to talk through things that you need to talk through. You're so busy taking care of and tending to everyone else. Who is tending and looking after you? Coping skills. I think that's one that I think is huge. Okay. Communication skills, coping skills. Those are two big things that I think a lot of people get from therapy, is learning actually how to talk to other people, how to talk to your spouse. Couples therapy, huge, important, right, for many couples. Individual therapy, important for many people, whether they're part of a couple or not. People who are parents, people who are children, learning how to understand why it is you think and feel the way you do, and also learning how to cope, right? Because that's not just automatic, and also learning how to communicate with other people, how to communicate how you feel, how to communicate what's going on in your mind effectively so that you can have productive relationships with the people around you. And I would also say too that some of my patients, they say, well, Dr. Jen, I know you're saying I should go to therapy. I don't know what I think about this. I've had patients say, well, my issue is that I lost my husband and therapy's not going to bring him back. Or they may say, Dr. Jen, my issue is that I lost my job and therapy is not going to get me a money tree to help take care of my family. And this is the thing, a lot of people say, I don't know how therapy is going to make things better because it can't make my spouse come back. It can't get me a money tree. And you're right about all those things, right? What therapy, in my opinion, does is it helps us cope with the environment and the situation that we've been given. It helps us cope within this space of having lost our job or having lost a loved one or whatever the case may be. It allows us to function and cope within this environment in a way that we can cope and function more productively, in a better way, that we can survive what it is that we're going through. That's one of the things that therapy helps us do, is to survive the situation, the hand that we've been dealt, the situation we've been given. Now, a lot of people, so I'll also say this too, because a lot of people will say, and I say this as a God-fearing woman. I am a God-fearing Christian woman. And you don't have to be religious, but I'm letting you know how I feel. And sometimes people will say, my patients will say, well, Dr. Jen, that's what I have God for. That's what I have church for. That's what I have my pastor for. And you know what? I'm with you. I could not agree more. But what I will say to that in addition is, and this is my personal belief, but hey, this is my Facebook page, this is my YouTube channel, so I'll tell you what I think. But in addition to those resources, those amazing resources that we have, which God to me is the ultimate resource, you're absolutely right. And our pastors, our clergy members, our church, our congregation, our spiritual home, right? This is my opinion. But I've always felt that God has also provided us resources such as therapists and psychiatrists and psychologists, and has provided the way for medications, and provided us ways to feel better, to cope better, to function better, to do better. I see all of that as sort of under the guise of what God provides for us. Now, I say all this knowing that you don't all necessarily believe what I believe, and this conversation is not meant for you to need to. But I do need to say and to address those who say to me, well, Dr. Jen, God is all that I should need. And I agree. But I also say that I believe that God has also provided us amazing resources to get through this amazing, sometimes crazy world that we're living in, such as therapy, such as medications. So that is something I just wanted to throw out there, because I think that sometimes a little bit of food for thought can be helpful. By the way, I want to know what you think, because I'm sure you guys have a lot of thoughts. I'm going to tell you a few ways to find a therapist if you've ever been thinking about this, okay? Because I know that sometimes cost can be an issue. Sometimes finding one can be an issue. I completely understand that. And by the way, I see all of you guys. Thank you so much for being on with me. Thank you guys for sending stars. You guys are amazing. Thank you on YouTube for sending super chats and super stickers. You guys are awesome, and I so appreciate you. So the long and the short of it is, and before I go into how to find a therapist or how you do this, is to say to yourself, okay, look, maybe you don't have anything on this list of things that I gave you, okay? But you don't have to. All it takes is for you to feel like, gee, maybe it might be helpful if I talk to somebody. That's all you need. You don't need an excuse. You don't need a huge justification. You don't need a huge, oh, let me tell you what. You don't need any of that. All you need is the feeling inside that maybe you could use someone to talk to, someone who's licensed and certified to help you through certain times in your life using different techniques such as cognitive behavioral therapy and other types of therapy techniques that psychologists and licensed mental health professionals use, okay? They're almost like counselors. They're guides, okay? So a few ways to find a therapist, and I want to know if you so want to share and so choose to let me know in the comments if you see a therapist, if you have in the past, if you wondered about or been concerned about seeing a therapist but was interested. The reason why I always ask you guys to comment is because, to be honest with you, other people read what you write, and more times than not, many people really learn from what you all have to say to one another. So I say that. So ways to find therapists, to find a therapy. First of all, there's a lot more ways than there used to be. First thing you can always do is call your doctor. You can call me, call your doctor. But you don't actually have to see a therapist, okay? You can, if you have health insurance, you can call the number. I always get my patients, and I actually see somebody saying you want a Christian therapist. Totally fine. I love that idea. One of you saying, I'd love to see a Christian therapist, and that's fine. By the way, in some ways, therapists are kind of like massage therapists or whatever, or gynecologists. You may say, I want to see a man, I want to see a woman, I want to see this, or I want to see that. So I really love that you guys are mentioning these things because, by the way, you have the options. You can see somebody that's close to your work, somebody that's close to home. You can say, I just want to see them over telemedicine. I don't want to go in. Guys, there's a lot of things and a lot of options with this, so please keep this in mind. The other thing you can do is if you have health insurance, you can call the number on the back of your insurance card. For mental health inquiries, sometimes there's a number. For behavioral health, sometimes it's called, or sometimes just a number to call for, you want more information. Call that number, and you can find a therapist usually who's within your health insurance plan in terms of money, okay? That's very important. But other ways, okay? Psychology Today is a resource that has a lot of great evidence-based information, psychology information. It's a website. Go to psychologytoday.com, or maybe it's .org. I don't know which one it is, but Psychology Today, if you just put it in, it's a huge resource. It's really cool because they actually have on their website ways that you can actually find a therapist that way. Literally, easy peasy. And I even believe that they help you find a therapist through like certain insurances and stuff like that. Awesome, right? Another thing you can do, there's an app called the 7 Cups app. 7, like the number 7, Cups app. Yep. That's a therapy app that many people use. Also, there are plenty of other apps too. And I found a website called cyberguide.org. In fact, I think it's actually called onemindcyberguide.org. I know it's a long name. Onemind, ONEMIND, cyberguide.org, PSYBERGUIDE.org. And I found this on an online resource as almost like a clearinghouse to find other apps that can be very helpful for therapy, okay? Because apps can be really awesome. There are free resources for therapy. I think that as things have changed over the years, there are more options now for therapy than there used to be. You don't have to go in person necessarily. Also, I really love the American Psychological Association. That's APA.org. Go to their website as a way to sort of help you find resources for therapy, etc. There are a lot of options, a lot of resources. Guys, this is just sort of the tip of the iceberg, but it's an important tip of the iceberg that I wanted to bring up to you and talk to you. This was on my heart because it's so interesting. I've been having these conversations a lot with people I know, my family members, and just sort of thinking through things. And the first thing that one should know is that you should never, ever have any shame about contacting a mental health professional. Think about it as, do you have shame when you throw out your back and you see your doctor? Or do you have shame if you sprain your ankle? Do you have shame if you get cancer? You shouldn't. So why would you have shame if you decide that seeing a mental health professional is a good thing to do? I hope that you don't feel like that. And honestly, seeing and talking to someone can be literally life-changing for all the reasons I mentioned and so many more. So this is the thing. Let us know in the comments what your experiences have been, what has helped you so that you might be able to help other people. And by the way, one person has just mentioned the federal government. Jacqueline, thank you. The federal government provides all their employees is something called EAP, Employment Assistance Program, Employment Assistance Program, the EAP program. It's confidential, usually available through your workplace. That's right. That's something else I didn't mention. I'm so glad that you said that because you can oftentimes, even if you don't work for the federal government, I would actually actually still call your human resources, because you may have an employee assistance program through your work site where you can be linked up with a counselor that is confidential and is not going to tell your boss or anything like that. Okay. So these were great suggestions and resources. You guys are amazing. Please just keep this in the back of your mind or in the front of your mind, that really, when we talk about taking care of ourselves, we're really talking about mind, body, and spirit. Mind, body, and spirit. It all matters. So guys, I hope this was helpful. Let me know in the comments. For those of you on Facebook, I see you. Thank you for the stars. Please like and follow my page if you haven't. And also, don't forget, I have my Dr. Jen Superstars group. That's my subscription group. And for those of you on YouTube, hello. Please subscribe to my channel, click the little bell for updates, and consider joining my subscription groups too. Guys, let me know. Tell me what you think. I hope this was helpful. Bye.